Hi everyone, I'm here with Jake Covert, Dr. Jake Covert. How you doing today?
I'm good. Thanks for having me.
All right, we're going to talk about trying to get quick or immediate lower back pain relief, and you're going to give us a tip or two. So, if you guys are interested in our weight loss program, hit the QR code on the screen or the link in the description. And if you're interested in interviews with doctors, nutritionists, personal trainers, subscribe to the channel. All right. So, what kind of lower back pain are you talking about?
I see a lot of cases come into my office where acute lower back pain, I'm sure most people have experienced at one time or another. Most people, I would say, you'll wake up, it'll flare up, and you can't even bend over. And so the biggest thing that I see can help with acute low back pain is number one, trying to keep your daily routine. Try your best to keep moving and to not limit yourself because of the pain. If you just sit down and do nothing, it's just going to get tighter and you're going to continue to have the pain. So the biggest thing is movement. And then speaking on movement, I would say walking. Walking is one of the best things that you can do for lower back pain, whether that's a 10, 20, 30-minute walk. Just the motion of your hips going back and forth really can loosen things up, get a lot of blood flowing, and help out pretty quickly with some acute pain.
So, if you just sit there or lay there, your back's just going to get weaker, right?
It can get weaker, but the biggest thing is you're just going to have a lack of blood flow essentially to the area. So if you have an acute muscle spasm and it's just seized up and you're sitting on the couch, you're just all you're doing is waiting for the time for the muscle to relax. Why not help yourself out? Try to get a little bit of movement. And that's why typically with these acute muscle issues, hot showers feel good because when you're in a hot shower, you'll put the hot water over the area. It'll increase blood flow to the area to help loosen it up a little bit. So then it's a little bit easier to move. So the key is really just as much blood flow as possible and keep moving. Now, if you were injured, that's a different story. In that case, heat can be detrimental because if you do have some sort of acute inflammation happening, it will make it worse.
Right. Because if you're injured, the heat will inflame it.
Yes, it'll inflame it further.
All right. So, it's just irritated. Then you could sit in the spa or the sauna or whatever. That would be okay.
I would say after an acute injury, you'd want to technically wait about three
I
days,
mean, not
essentially.
the injury, but just
Oh,
the.
Oh, yes. Yeah, a sauna would be even better because that's a wet heat, which transmits even better. So, yes, any sort of heat for kind of one of those muscle spasms would be
Sauna,
great.
you mean a steam room? That's the wet heat.
Yes, the steam room. Thank you. Yes.
Okay. So, is there any other movements you can do?
I would say a lot of people respond to a lot of kind of extension based movements. So, for example, if you're lying face down on the ground and you have your arms out in front of you and you do kind of a cobra press straight up into the air, if you do some light kind of oscillations in that movement, that's a nice way to get a little bit of a pumping effect for the lower back as well. And your hips are supported, so you don't have to have a lot of core involvement with it essentially. So, it's a very quick, easy, passive or active, but light movement that you can do to just get a little bit of movement and blood flowing.
Right. And so you do a treatment, right? Like the treatment you do on my bicep, that would work too, right?
It is actually. It's been the Shockwave has been studied for some acute issues, and I have used it on several acute muscle spasms and had really good results from. And that again, because when the muscle tightens up, the Shockwave essentially it'll break up some of the tight muscle and it'll bring blood flow to the area. So I've had some really good results with it.
Okay. So for our listeners, tell them exactly what that is because most of our listeners, I don't think, live in our area. So if they're in other states or wherever they are, tell them how to find this for themselves and
Yeah,
what they're
so it's
looking for.
It's the biggest thing. So it's shockwave therapy. Specifically, you want to look for focused shockwave therapy. A lot of practitioners have what's called as radial shockwave, which it's essentially not as deep. It's very superficial compared to focused shockwave. But focused shockwave, if you do a quick Google search, you could say focused shockwave near me or focused shockwave in whatever city you have. And then if you do get some results pop up, I would just call the clinic and ask them, hey, is this radial or is this focused? And make sure that it is focused because that is key with this type of therapy because you'll get much better results with focused opposed to radial.
All right. So that's a treatment that you can all try that I know is pretty effective. And I know you're having incredible success with it. So Doc, if people want to follow you on social media or reach out to get a hold of you, how do they do that?
Yeah, my social media and website is both atlaschiropractic.us. And then on my website, I'll have my email, my booking site, and ways to reach out to me.
All right, Doc, as always, thanks for your input. Thanks for being here.
Thanks for having me, Steve.